Hey guys, welcome back to my channel. If you're new here, my name is Sarah. I'm a family nurse practitioner. In today's video, I'm going to talk about some challenges that I face at work every day. So, as you all know, I work in the urgent care, and I think it's important to be transparent about not only the good things, but the more challenging things that I face at my job because I want to shed light on the career. And for those aspiring nurse practitioners or those people who are interested in maybe pursuing a career in the urgent care, I want to give you guys the heads up, okay? Some of these things may be specific to the particular clinic that I work at, but I'll let you guys be the judge of that. So let's go ahead and get started. So as you guys know, just by visiting urgent cares for yourself or your kids, you know that the urgent care is a very fast-paced environment. So people come in with the expectation that they're going to get in and out quickly. And if I don't move quickly, I'm going to get backed up with patients. I'm having multiple people coming in, and sometimes their complaints can be pretty complex. At any point in time, I can have somebody walk in the door with a complaint of chest pain or dizziness, which is a longer workup. And then another patient can come in complaining of cutting their hand open while chopping up vegetables for dinner. And I could have a sports physical in another room. And all of these patients expect to get in and out within a reasonable amount of time. So that's when, okay, I have to think to myself, let me prioritize. So the sports physical, I could probably get in and out really quickly, whereas the laceration repair, it's going to take me a little bit longer. The chest pain patient, they're going to take priority. And then the person with dizziness is going to be a longer workup. So it's really a lot of juggling, prioritizing, and trying to figure out what patients demand your attention first, which patients are going to take longer to work up, with the general idea that, okay, I want to get these patients in and out the door so that everyone's happy. This next point is specific to your job location, right? So I told you guys I work at two different urgent cares. At one urgent care, I do not run into this problem, but at the urgent care that I work at, more often I do, and that is the lack of help. So at one of my urgent care jobs, I have one medical assistant much of the time. And that medical assistant is responsible for checking patients in who walk in the front door, triaging the patients, and running all of the tests. So, as you can probably imagine, I'm helping out a whole lot because if there are patients who require testing and we hear the door alarm go off, letting us know that more patients are walking in the door, she has to go manage that while I manage everything going on in the back. And that's why you guys see me doing a whole lot of testing on my Come to Work With Me videos. So, that can be stressful because I get backed up with conducting tests, splinting patients, drawing blood on patients. These tasks can be very time consuming. And so I'll finish, but I still have all of my charting to do. So I still have to take care of my responsibilities as a provider as well. So that can be very challenging and very frustrating. Another challenge that I face is having to be prepared for anything. So I have to be prepared for everything in the urgent care, from the most minor of injuries to life threatening emergencies. And this is actually what freaked me out the most when I first started my urgent care job because everything was just so unpredictable, right? So it's important to recognize those red flag symptoms that warrant calling 911 and transporting the patient to the emergency room. So always being prepared and always staying on your toes is very necessary in the urgent care. Something that I found that helps me is always assuming the worst so that I don't miss anything important. It's easy to get into this cycle of, oh, it's probably not a big deal. But see, that's when it truly is a big deal and you'll miss it. So I try to always stay on high alert, but without feeling anxious and stressed out about it. Another challenge that I face in the urgent care is limited resources compared to the hospital or more specifically the ER. There are certain tests that I obviously cannot conduct, such as CT scans, MRIs. I do not have an ultrasound machine at my urgent care. So I'm limited in the sense that there's certain diagnoses that I just simply can't make. And if I have a high clinical suspicion, then I'll have to send that patient. Obviously, I can't check something like troponin levels for a patient coming in with chest pain. That's why education is so very important for patients because I want them to understand all of the risks that are there and my limitations being in the urgent care. So sometimes that can just be a little bit frustrating because after they go to the emergency room, I don't know what happens to them unless they come back with another complaint like a year later or something. It does kind of pique my interest, and it makes me very curious. Like, I wonder if I was accurate in my diagnosis. I wonder what ended up happening with that patient after I sent them to the emergency room. So another challenge that I face in the urgent care is my charting can get backed up. So remember, I told you guys that oftentimes I'm doing the task of the medical assistant. So the issue with that is I still have all of my charting that I have to complete. So if we have a rush of patients come in, let's say at the end of my shift, and the medical assistant is checking patients in, and I'm in the back doing testing, drawing blood, placing splints on people, these sort of things, this is all time that I otherwise would have spent charting. So I can get backed up, and then I feel like I'm like racing against time, trying to hurry up and catch up on my charting so I can get out of there on time. So that can be very challenging as well. So did I experience this in my other nurse practitioner positions? Not so much, because I didn't have those other responsibilities that I had to complete. I pretty much was able to stay in my lane and complete my job and then go home. So this is actually something that I'm really trying to work through, helping out, but also understanding that I have to do my job and I don't want to do myself a disservice by doing other people's job and helping out the team to my own detriment, pretty much. So I'm trying to work it out. I was talking to a friend about it, and she said, don't do the medical assistant's job. But if I don't help out, I'm going to be there all night. You know what I mean? So I'm still trying to find that balance of being a team player, but also looking out for myself as well. Let me know in the comments if you're a nurse practitioner or a medical provider, how is charting for you? And do you get backed up with your patient charts? Let me know, because I'm actually curious about that. So, as a provider who cares for both the pediatric population and adults, it can sometimes be challenging because I have to be able to recognize red flag symptoms across a wide range of ages, from pediatric rashes to safely prescribing medications for geriatric patients. There are a number of different factors that come into play when you're caring for such a wide range of ages. So that's definitely a challenge. I would say that it definitely makes me more marketable as a provider. So I'm grateful for having that skill. But you kind of have to like flip a switch in your mind based on the type of patients that you're seeing. And you have to keep that into consideration as you're caring for these patients. So those are the most common challenges that I face at work in the urgent care. Let me know in the comments, what are some challenges that you face at your job? All right, guys, I will see you all in my next video. Thanks for tuning in. Bye.